Our best evidence topic is the efficacy of AAC devices increasing social participation in adolescents with cerebral palsy. Our group members are Mackenzie Biddix, Darius McLean, and Kayla Jarrett. This clinical scenario led to our evidence-based question. An adolescent with cerebral palsy feeling socially isolated due to insufficient communication abilities. Peers cannot understand her speech at the school she just began attending. Decreased communication skills have led to a reduced amount of social participation with her peers. Lack of communication has led to diminished opportunities to learn social skills. A reduced amount of social interaction has led to social isolation and emotional distress. She has a decreased overall quality of life due to an inability to socially participate with her peers. This is our evidence-based occupational therapy question. Is the use of augmentative and alternative communication, AAC, devices efficacious at increasing social participation and peer relations in adolescents with cerebral palsy who have limited communication? The evidence search performed was based on these criteria: the population, adolescents with cerebral palsy; the intervention, the use of augmentative and alternative communication devices; the outcome, increased social participation and decreased social inclusion. The key words we used in our search were various combinations of these terms: adolescents, cerebral palsy, AAC devices, social participation, social inclusion, peer relations, school, and education. We found articles in these databases: PubMed, ProQuest, EBSCOhost. In PubMed, we found 4 articles that worked for our EBP question. In ProQuest, we found 1 article that worked for our EBP question. In EBSCOhost, we found 4 articles that worked for our EBP question. This was our inclusion and exclusion criteria. Inclusion criteria: the patient population, adolescents, ages 13 through 19 with cerebral palsy with limited communication and/or experiencing social exclusion. The intervention: the use of AAC devices as a way to increase social interaction need to be addressed in the study as a part of an intervention strategy. The exclusion criteria: patients receiving another form of intervention strategy that is related to communication and social participation apart from AAC devices were not included in the search. Levels of evidence for the articles obtained. We found 3 articles that represent level 1, 2 articles that represent level 2, 1 article that represents level 5, and 3 articles that were qualitative studies, for a total of 9 articles obtained.
Critical Appraisal Level 1 Systematic Reviews. Some of the positives our group found in the systematic reviews are the impact of AAC equipment on communication and social skills had a slightly positive effect in the reviews. Also, the impact of AAC equipment extends to other domains in the reviews, such as education, leisure, and community living. Unfortunately, we did find several cons with our systematic reviews, such as that they focus on youth with various disabilities and not specifically cerebral palsy. They still lack evidence as it relates to the efficacy of AAC devices increasing social participation. One systematic review only focused on RCTs, limited the scope of articles to be reviewed, and overall the need for more research on use and treatment for individuals with communication impairments with AAC. Critical Appraisal Level 2. The pros we found for these articles is that one study found that familiarity with devices and gender impact typically developing peers' attitudes towards AAC user classmates. Females were more likely to have a positive reaction to their AAC device. Students that were familiar with AAC devices were more likely to respond positively, and studies looked at several different groups for comparison. Clarifies information from several different sources, uses other frameworks and references to increase validity of the findings. The cons we found were there is need for more research, specifically a need for a larger sampling population to accurately say those with communication deficits without AAC devices are less social. Critical Appraisal's Qualitative Studies. In our qualitative research, our pros were that AAC use impacts social interactions and communication abilities within the pediatric population. Use of interviews provide a personable account of the impact of AAC on social inclusion and social participation. The cons we found was that there's little research to evaluate the impact of AAC devices on social participation and communication abilities. Lack of AAC equipment training creates communication barriers. Low-tech AAC equipment is too slow for communication purposes, and qualitative studies make the research subjective, not relying on statistical measures to evaluate the efficacy of AAC devices on social participation.
Summary of evidence. The qualitative studies reviewed demonstrate that AAC devices do have a positive impact on social inclusion, social participation, and communication abilities. There are barriers associated with AAC, which include inadequate training, technology that's not advanced enough, and technology that's too slow to hold meaningful conversations. Also, the qualitative research design limits participants, they're subjective, and the less credible when concerning best practice. The impact of AAC on social participation within this population was only found to be slightly positive. Also, there's not enough research to confidently utilize AAC as an intervention strategy to increase social participation within the selected population. Clinical bottom line. Based on the current best evidence, there is not enough credible research to conclude AAC devices are efficacious at increasing social participation among adolescents with cerebral palsy who are experiencing communication limitations. Though there is credible research saying that these devices are able to enhance social participation and communication, the research findings do not directly state that AAC devices are the key intervention in increasing social participation within this population. Implications. For occupational therapy, more education on AAC including training, impact on users, and impact of AAC devices on attitudes of peers, which could be observed within the classroom setting. The intervention strategy using AAC devices to increase social participation in adolescents with cerebral palsy needs to be aired with caution due to the lack of research. For education, we have continuing education courses for occupational therapists and clients on effective use of AAC equipment. Also, the implementation of AAC equipment into the curriculum within the academic setting. This should also be aired with caution due to the lack of research within this area. For research, we have more research to address the efficacy of AAC devices as it relates to various populations of diagnosis in general. There are many other individuals who could also benefit from AAC equipment. More research concerning AAC devices used as an intervention to increase social participation specifically, to make sure that there is actually a chance that with an AAC device that social participation will be affected in a positive way and not a negative one.